And I think that addresses probably an interesting area. I mean, you've seen we have so important developments with drug-coated balloons following a, if you want, a stentless approach. And in parallel, we have effective drug-eluting stent technology. And the question to us when we started the study was to kind of figure out a little bit in a pilot study, so for which type of lesions one or the other approach might be more beneficial. So what we did is we basically performed an investigator-initiated study with the support of Cook with a research grant, where we enrolled a total of 150 patients. We randomized 1-to-1 of DCB versus silver PTX at this time. And what we did is these 150 patients, we stratified according to the lesion length. So 1/3 was enrolled with short lesions, shorter than 10 centimeters, 1/3 with intermediate length lesions, and 1/3 of the patients had lesions between 20 and 30 centimeters. As a result of that, you can see that we had a quite respectable overall mean lesion length, around 15 centimeters, so giving us a quite challenging cohort. And the study was done with all the rigor of a good scientific study with independent core lab assessment for angio and duplex and 100% source data verification during monitoring. You can see here the total duration of the study was 3 years, and I want to show you those data today. Primary endpoint was actually primary patency at 12 months, and then we had a number of secondary endpoints as typically done. You can see here the randomization flow chart. As I told you, 75 patients with DCB treatment and 75 with drug-eluting stents, and quite a reasonable retention of the patients out to the 3-year time point. Looking at the patient characteristics, the clinical characteristics, I think there's really nothing of note. What we can say is the majority of patients had claudication, rather for 2 and 3, relatively few patients with critical limb ischemia. That was a result of the protocol requirements. Can look here at the lesion characteristics. As I told you, the overall lesion length in the study was fairly long, around 15 centimeters. You can see that there were, there were about more than 50% chronic total occlusions, about 20% popliteal involvement, so clearly a challenging patient population. And what's also interesting to look at the bailout stent rate in the DCB arm. You know that there is a variation of this number. In that study, it was 25%. I think considering the complexity of the population, that is in line with our expectations. So this slide, I think, is probably the most important one of the study, showing the primary patency of the two treatment groups over the 3-year time period. So very clearly what we can say at the time of the primary endpoint, which was pre-specified at 1 year, essentially the curves do overlap completely, and there was no difference in treatment effect at the 1-year time period. Beyond that, what we can see is that there is a trend that somewhat more events occurred at the 2-year and the 3-year time period in the DCB arm as compared to the silver PTX arm in the study. You can see here that these numbers at 3-year were 54% primary patency for the silver PTX and relatively low primary patency with only 38% for the DCB arm. If you looked a bit more specifically on the DCB arm, as I mentioned, 25% had bailout stents. You can see here the display of the curve for DCBs only, and for the patients with bailout stents, so essentially no real effect here out of this additional stent placement visible. What was interesting was to look at the different lesion groups, short lesions, middle length lesions, and long lesions. And I think what we've seen here, that really for the short lesions at 1 year, but also at 3 years, essentially no differences were noted. So I think we tend to conclude that really for short lesions, both treatments did equally well. I think for the middle and long lesions, this is not so clear. You can see here that for the middle length lesions, there seems to be a better durability of the treatment with the stent-based treatment. For the long lesions, we had some early events here in the stent arm due to probably improper vessel preparation. So I think the findings were not so clear. What we did do to enhance a little bit the power of the study, because of we only had like 50 patients in each subgroup, we now summarized the patients with the lesions longer than 10 centimeters, because we thought this is the population where we potentially might detect differences. You can see here the display of primary patency for those lesions longer than 10, and here you can see that really a benefit, at least a trend towards better outcomes with the stent-based approach has been shown. And if you look at this comparison of the DES versus the DCB patients, excluding the ones with bailout stents, then I think the separation of the curves becomes even more visible. However, it's a trend, and no statistical significance has been shown. So in conclusion, I think we can say at 1 year, essentially, there was no significant difference between the DCB treatment and the DS treatment for the overall cohort. Beyond 1 year, we see a long-term trend showing better durability of DES at 2 and 3 years. There's clearly an equal performance of DCB and DES in short lesions up to 10 centimeters, and there may be an increased benefit of DES in lesions longer than 10 centimeters, as shown by this post-hoc analysis, which of course needs to be verified in additional studies. One thing which is very clear, and we've seen that also in the DS arm of this study, that vessel preparation is mandatory for both DCB and also for DES to ensure an optimal use of the device, particularly in complex lesions.